Joining me now to discuss more about the virus and what lies ahead for the president and first lady, along with the successful treatment that he's been using with his patients, Dr. Richard Bartlett, a doctor with nearly 3 decades of experience who was tapped by former Texas Governor Rick Perry to help lead that state's healthcare task force. We want to welcome to the show Dr. Bartlett. Hello, Doc. How are you?
Great. I'm glad to be joining you. Thank you.
We appreciate it. I know you had a busy schedule, by the way. Your booker told us, so we're going to get right here to it. The president announcing yesterday that he has the coronavirus. Talk to us about what lies ahead now. He is a 74-year-old man. He's in good health, we're told, and right now he's showing mild symptoms. So what does he and the first lady have to look forward to over the next couple of weeks?
Well, we have a treatment strategy that we've treated over 1,000 patients in West Texas alone with, and we've had 0 deaths with it. And so that should be encouraging. Statistically, even before that was offered, over 94% of the patients with COVID in that age group would still recover. And so I'm expecting the president to recover entirely, and we have a strategy that will ensure that. It's at budesonideworks.com.
Okay, and Dr. Bartlett, let's talk a little bit about that, because I read some of your bio this morning and the treatment that you've been using on these folks that, as you just said, it's over 1,000 patients who fully recovered, and a lot of them are past the 60-year-old age bracket. Did any of them have any pre-existing health conditions that would have affected the outcome had they not gotten on the treatment that you're subscribing?
Yes, one patient is a grandmother with 2 forms of blood cancer, lymphoma, on chemotherapy, had radiation a month before, and with the treatment, she recovered over the weekend. Symptoms went away, had 2 negative tests after that. She's still on chemotherapy. That was 4 months ago. Another patient, 50-year history of smoking, a grandmother, had her chest cracked for 4-vessel bypass surgery on high blood pressure medicine, and with the treatment, she had shortness of breath and chest pain relieved with the first treatment, and she recovered entirely.
And I meant to say prescribing there, Doc, sorry about that. Let's talk a little bit about the survivability rate, because I think when the news broke yesterday that Hope Hicks, a close advisor with the communications department at the White House, had it, the media immediately began freaking out. And then late last night when the president sent the tweet out, of course, everyone now questioning, my gosh, what happens if he dies and we don't have a president before an election? Maybe he should step down. It seems to me that we hype this up so much when we forget to look at the facts. So this show is about truth and facts. So doctor, please, for people out there, remind them again, what is the survivability rate of this virus?
The survivability for the patients that I've treated with pre-existing conditions is 100% survival, 0 mortality. And that's with a strategy that's being studied by Oxford, by the University of Queensland, and other institutions. So there's evidence out there. This is a winning strategy. And so we should go with the winning strategy. Just to put things in perspective, over 50% of the people that, 50%.
Your Skype connection broke up just there a little bit. You said over 50%. We missed that last line. I don't want to miss any information here. So please repeat that, what you were saying.
So the evidence is overwhelming that the president and the first lady will be just fine. There has been a great deal of hype. We know 45 to 50% of citizens that get COVID don't even know they had it. They are asymptomatic. And so if he's asymptomatic, that's great. And we have a winning treatment strategy that's working as well.
Yeah, and let's talk a little bit about different scenarios for what people can do, because we've heard the president since day one talk about hydroxychloroquine. I believe he said he was on a small low dose of that. We've heard about the trifecta, mixing that with what, some steroids, some zinc, some other things. What's the trifecta of those 3 that they're always talking about combining? And I know people actually past 70 who've been using low dose of those 3. They've come in contact with people with COVID. Nothing, no symptoms, don't even have it.
So there's been a lot of controversy with hydroxychloroquine, both sides, and there's a lot of evidence that it's effective early in treatment. But the interesting thing is the strategy I'm using emptied an ICU south of San Antonio in 48 hours with patients that were severely ill in the ICU. And that was 4 months ago, and that ICU is still empty 4 months later. Wow. And so what we're talking about is a treatment that can be used in early or late disease. And actually, it's a medicine that's being used by millions of Americans every day for the last 20 years as a preventive strategy for healthy people so they don't get sick with asthma attacks.
Wow.
The medicine's called, yeah, so it's safe. It's used on 2-pound preemie babies in the ICU. It's used on the fragile elderly in nursing homes. And as I said, millions in America are using this daily for the last 2 decades. And so you've never seen it in the news because it's super safe. But it seems to be very effective. And as I said, I've had a 0 mortality rate, and over 1,000 have been treated just in West Texas with this strategy. And so the strategy is being used around the world, actually. We're getting calls from Peru, from Australia, from doctors and patients. And so overwhelming success. I think that the president's future is very bright, and therefore the country's future is very bright.
Yeah, we saw what happened with the market as soon as it opened up after hearing news. Investors didn't like that. The market tanked. Of course, you have all of the lamestream media, I'm going to call them lame, all of a sudden jumping on the bandwagon. There are people within the media, elected officials, Americans wishing harm on the president, which just disgusts me. We'll get to that a little bit later in the show. Talk to me about your dealings with a couple of governors, because I read, I believe, in your bio that you've been now influential in helping out Texas, Tennessee, and I think today you're meeting with folks from Oklahoma, and governors are listening to you. They're looking at this therapy you're using. We heard the president talk about different therapies out there like yours that are working. You've convinced some of these governors that it's okay, let's open up. Because as we've heard from the CDC director, and you as a doctor with 30 years of experience, we will have more deaths if we stay closed down longer than if we didn't. We have to get reopened. So talk to me about that in the discussions you've had with some of these governors.
Well, as a medical expert, giving advice to the governor for all the citizens of Texas for 7 years, that's my background. I'm interested in facts and science. And so instead of the science fiction that's been forced upon us from Fauci and others saying, we'll wear a mask as a symbol, and then it becomes a mandate, those things are obnoxious to me as a doctor because I'm interested in facts and science. We talked to the governor of Tennessee and then gave him the information that he needed, and he chose to open up the state and follow the lead, the wise lead of the governor of Florida. And Indiana has made those moves, and Texas has moved towards being more open after we presented our information. So we are looking at all states opening like a domino effect with no negative repercussions. That's based on science and facts. But if you look at lamestream media, you're going to get more of the same. You're going to get more of the same. It's not science. When you say we're going to wear a mask as a symbol, there's no science behind that statement. And no science, no double-blind placebo studies that Fauci has offered. When you say don't sing in church, but you don't say sing in any other facility with no science behind it, that's Dr.
Right.
Birx. We got to let go of these things that have nothing to do with science and go with the facts, go with science. Evidence is overwhelming. We should in our states, and we have some winning strategies that need to be employed. Early treatment with effective therapies. And what I'm talking about at budesonideworks.com is an effective therapy.
Yeah, great. I'm glad you threw that in. They're wrapping me up. I want to get a point across to viewers out there, and hopefully our conservative friends share it with your independent, your liberal friends. The death count number, CNN loves to keep it right there on the screen all day to scare Americans, and that's one thing the mainstream media is guilty of, is hyping this and scaring the American public. I would like you to clarify something, 30 seconds or less, Doc. I remember, because I'm a news junkie, hearing the CDC director say that hospitals are marking down died with and died from, and that death toll count we see at 207, 208 is died with and died from. Please quickly explain the difference. I get died from. The disease killed you. Died with, you didn't. You just had it in your system, but died of something else. So the count of 208 is not correct. Is that correct, Doc?
So they're constant, the moving numbers. The numbers are moving constantly. The recommendations are going back and forth. But I want to say again that over 1,000 have been treated with this strategy, and the mortality rate is 0% with people with cancers, heart disease, elderly. And so we have a bright future. Look at Taiwan, 21 million people, only 7 deaths in 9 months of this pandemic. That's right, 7 deaths during the whole pandemic in Taiwan, because they're using a similar strategy, early treatment. And we need to jump off this losing strategy that's been forced on us and get on a winning strategy like Taiwan, Japan, 121 million, less than 1,000 have died during the whole pandemic.
Wow.
I'm telling you, winning strategy.
All right. Dr. Richard Bartlett, I know you got to go. You're speaking with more governors today and more press. Keep pushing, get the word out there. We have to stop freaking out about this thing and get it under control and use, like you said, winning therapies that will save Americans' lives. Doc, we'll have you back on the show. I'm sure this is not the end of the discussion on the coronavirus. Appreciate you coming on Real America.
Thank you.
Straight ahead by now, hopefully you've seen the Project Veritas's undercover videos exposing real voter fraud and ballot harvesting in Minnesota. After the break, a local assemblyman from that state will join us to discuss where the investigation stands right now. Don't go away.